Okay, good morning. This is Dr. Joseph Paun with Paun Family Chiropractic and Wellness. We're located in Highland, Indiana. And this morning, Dr. Joe is going to explain to us how pain can lead to arthritis and what exactly it is that the adjustment is doing.
Okay, this is a good question, a question that we get from a lot of our patients. So a typical scenario is a patient falls on their butt or their back and injures themselves. They don't necessarily have a disc problem, but they have something that leads to a muscle spasm. So what happens then, this is like a joint in our back. This would be lumbar vertebrae, L5, S1, say. We have muscles that span both sides of that joint. And then this here is cartilage that keeps that joint flexible and mobile. So we have an injury. Our body causes a muscle spasm to basically prevent movement, because movement is what causes us more discomfort. So, we bend forward, we extend backwards, or we bend laterally side to side, and that causes pain. So our body intuitively knows, okay, we don't want movement, we're going to tighten everything up and prevent, the pain from happening. So as that muscle spasm happens, and remember, muscles go from joint to joint, what it does is it compresses that joint. Again, remember, we have cartilage here and we have cartilage here. Now that joint's getting compressed and it's getting pushed together, and that's why we can't move quite as much as we normally would. That's why we can't bend in certain directions without having pain. Well, over time, what happens, there's a capsule also that surrounds that joint. So that capsule actually shrinks. Over time, you don't get that back. And through chiropractic manipulation, it allows us to get movement in that capsule. On top of that, the capsule inside of it contains a fluid that keeps the joint hydrated, lubricated, and healthy. And when that capsule shrinks and it's not, you're not getting the movement and nourishment in that joint, problems start to happen. Like I said before, the joints just get compressed, the capsule shrinks, we lose range of motion, maybe we can't turn our neck as far as the normal way that we would, maybe we can't bend forward as much as we normally would be able to without pain. Now what the chiropractic adjustment does, again, is it gaps that joint, right? So it takes a joint that's very tight and angry and it gaps it, and now we're able to bend laterally side to side. Now we're able to flex and extend and have, be relatively pain-free. And that's really, over time, that accumulates. We get more movement in that joint, we get it healthy, we get it nourished, we get those tissues flexible, and we get that capsule stretched out. The difference between what we do and what a muscle relaxer does is we get specific. We find the joint that's restricted, we get nourishment, movement, lubrication in that joint, versus a muscle relaxer, which is going to relax your elbow just as much as your lower back. It's not specific. Not to mention there are a bunch of other complications with long-term use of muscle relaxers. So that is the way that pain can directly contribute to arthritis. Again, just by having that joint be so tight and compressed that cartilage on both sides of that joint dies, and then that capsule actually shrinks, preventing you from doing what you want to do in the future.
Thank you very much.